Okay, so now we'll start. I'm presenting my screen. My screen is visible to all.
Yes, ma'am.
Okay. So now it is too late, but still we'll complete it. No problem, because very short topics are there, and with this today we will complete with gynecological disorders. Okay. So yesterday, what we have studied about last topic. Can anyone tell?
Obesity.
Obesity. So with that we have completed with endocrine disorders. Now we'll move towards gynecological disorders. Okay, dysmenorrhea first we'll go for. This is the whole topics which are involved in our syllabus for gynecological disorders or obstetrics. What is obstetrics? It is something which is related to reproductive health or reproductive studies. Okay, so these are our topics. So today we'll go for the first dysmenorrhea. What is the first dysmenorrhea? We'll see that what is today with today's slides will not have any pictures. No pictures because it's too fast. Okay. So female reproductive system, what it does, the function is to make the eggs and provide the place to support the and nourish the developing human. That means its main function, we all know that ovaries are there. Ovaries release the eggs. Further, these eggs will help in the reproduction and will leads to the formation of the new offsprings. Okay, and this uterus, which is also involved in the reproductive system, is the one which upholds the baby and the child or the like zygote, and further leads to the human formation. Okay, the internal structure of the female reproductive system, it involves vagina, uterus, ovaries, fallopian tubes, etc. All you have studied in anatomy and physiology. Just to have a glimpse. Okay, external structures are labia majora. These are the parts which are useful for the protection of that organ. Okay, both are for the further protections. Okay, we'll see. Now main will go for dysmenorrhea. What is dysmenorrhea? So dysmenorrhea, it means the painful menstruation. Whenever the female have menstrual cycle or periods, she when it will whenever it will be painful for him, it not always it will be diagnosed as it is dysmenorrhea, but certain symptoms that can lead to dysmenorrhea. Okay, but more realistic and practical definition, it includes the cases of painful menstruation that it will be its pain or its quantity is sufficient, its sufficient magnitude, its quantity is that much that it will hinders the females day-to-day life activities. Okay, therefore it is written incapacitative day-to-day activities. That means it will leads to or hindrance in their day-to-day activities. Okay, they will not be able to continue with normal activities as they have in their daily life. Okay, so what are the types? They are dysmenorrhea. It is of the two types: primary dysmenorrhea and secondary dysmenorrhea. What are the what is the primary dysmenorrhea? Primary dysmenorrhea is nothing but the pain usually begins 1 or 2 days before the periods. Okay, whenever the female will going to have start the menstrual cycle, the pain will start with 2 or 3 days before the periods. Okay, or when bleeding actually starts and can last for the several days, for 3 to 4 days it can last. Okay, you may feel the pain ranging from the it starts from mild to goes to severe in the lower abdomen region, because usually the part where uterus is the position of the uterus, of course, that is lower abdominal region. So the pain will be that one can lead to the back, thighs, hands, usual females used to have. So you all can understand, and the pain typically lasts for 12 to 72 hours. That means 1 or 1.5 days. Okay, and the pain is often caused by the uterine muscles contraction. Usually, why these pains happen? Due to the uterus. In the uterus, there is the myocardial layer. Sorry, not myocardial, myometrium layer, where the contraction of the muscle, uterus muscles will happen. This contraction will leads to the pain. Why this contraction happens? This contraction happens so that the easily the flow will happen, but sometimes it could happen due to some conditions that the flow is not happening, and uh, these muscles are regularly contracting. It could lead to the pain. Okay, therefore the uterine muscle contracted to help shed the uterine lining. So these contraction will are helping, or these contractions helps us to shed up these blood linings easily. But due to some problem, the linings are not shedding up, it is not bleeding properly, but still contraction is there. So therefore it can lead to pain. Primary dysmenorrhea is one where there is no identifiable pelvic pathology, which means there is no medical condition behind this primary dysmenorrhea. Okay, there is no pelvic pathology means no underlying medical condition which is leading to this type of pain. Okay, this is usually, normally it is happening usually in adolescent girls. Usually it happens for the young girls or adolescent girls, or the girls which started with their menarche. What is menarche? Menarche is the first period when it happens, is called as menarche. Okay, so it appears within the 2 years of the menarche. Within the 2 years, that means the girl is young. So for the young women it is very common, and who have the normal reproductive organ. Okay, normal in starting. Then what are the causes? Hopefully primary dysmenorrhea is clear to all. This is very easy for today, therefore we can complete fast. Primary dysmenorrhea okay for all?
Yes,
Yes,
ma'am.
ma'am.
Very good. Okay, so we'll complete now. Causes, so psychosomatic factors that I told you that every like they may have tension, stress, anxiety, depression, something related due to their lifestyle problems or anything. They can lead to this problem, because again stresses are contracting their muscles, leading to the pain. No proper flow will happen. Okay, that you can like revise all that in this series. Okay, how the mental problems can lead to physical problems. Uterine myometrial hyperactivity. This I was telling you that if uterus is there, the uterine means uterus, myometrium. The middle layer is myometrium layer, which is hyperactive. Hyperactivity here means contraction. Okay, more and more and more contraction, which is leading to this. This could be also the causes of it. Imbalance in autonomic nervous control on the uterus muscles. There is no proper control on our uterus muscles of autonomic nervous system. Role of prostaglandins. Though prostaglandins have all the roles: vasodilation, vasoconstriction, but that part which is leading to vasoconstriction, that means contraction in your muscles, will lead to this dysmenorrhea. Okay, big causes of this. Then symptom, that is spasmodic pain confined to lower abdomen. That means regular pain the girl is having, and or due to the contraction, this pain due to the contraction, or pain begins few hours before or just with the onset of the menstruation cycle. In normal, just before the menstrual cycle or few hours before it. Sometimes may radiate, or few days also. Okay, 2 3 days before the pain could happen. Okay, sometimes may radiate to as I told you, in thighs, back, in lower back, usually in the lower back, but could happen. And headache also sometimes it could leads to. Therefore, further some symptoms are nausea, the feeling of vomiting, but not vomiting, hair vomiting, the fatigue. Of course, they will feel the whole lifestyle changes. Okay, diarrhea, usually go to urge for the washroom and all. And tachycardia. What is tachycardia? One is there is arrhythmia. Okay, what is arrhythmia? The rapid heartbeat. Okay, not rapid heartbeat. If there is imbalance in your heartbeat. Okay, and heart rate over 100 beats a minute. Like in normal condition it is normal, but when 1 minute, if it is going for the 100 beats, that means tachycardia. Okay, they can have that like palpitations also. Okay, symptoms like that. Okay, now treatment, psychotherapy, of course, for the psychological, their counseling and all. And NSIDs, this is not required the treatment. These are, NSID is nothing but non-steroidal anti-inflammatory drugs. Prostaglandin synthesis inhibitor. Inhibitor means stoppage. Okay, so as prostaglandin is leading to this one, your vasoconstriction, which leading to pain, you can go for that also. Only you have to require what is primary dysmenorrhea, what is secondary dysmenorrhea, and their management. Not required so much about the symptoms and all. Okay. Now, secondary dysmenorrhea. What is secondary dysmenorrhea? Normally considered to be menstrual associated pain occurring in the presence of the pelvic pathology. Here, the pelvic pathology, in occurrence of pelvic pathology, and primary is without the pelvic pathology. As I told you, that pelvic pathology is nothing. It means that the person is having underlying medical condition or not. So, here in secondary dysmenorrhea, just 1 second. Uh, In secondary dysmenorrhea, the female will have some medical condition or some of the reproductive problems, reproductive disorders, which can lead to reproductive system disorders can lead to secondary dysmenorrhea. Okay. So the pain is often more severe than the primary. Of course, the prime it is more severe than the primary dysmenorrhea. May starts early in the menstrual cycle and can last longer. What are the main causes? Causes are chronic pelvic infection. As I told you, this secondary this your dysmenorrhea happens due to some reproductive problems or some disorders which you have normally in before only. It could also leads to the pain. So uterine fibroids in your uterus, then chronic pelvic infections, if any infection in your pelvic region, or endometrial polyps, accumulated mass. Polyps is something accumulated mass. We have studied this in polyps in allergic rhinitis also. If someone you should like remember now pelvic inflammatory disease, some inflammation in the pelvic region. Therefore, we also take these NSAIDs. Now, clinical features, the dull pain situated in the back, front, thighs also, okay, without any radiations. Now appears 3 5 days prior to your normal periods and will relieve after the bleeding. As we know that when like normal, we are having we have started with our menstrual cycle. So what happens in starting? There is more like contractions in your muscles like this. Contraction in the muscles is more, but still the bleeding is less. When the normal bleeding starts happens, what happens? The normal pain will also release. There is no pain in normal cycle also it happens. Okay. So duration of the pain depends on the pathology, what exactly the problem girl is having, which leading to the secondary dysmenorrhea. Treatment aims at the cause rather than the symptoms. Instead of symptoms, we have to make relief in their causes. What causing the problem? Okay. Yogic management now. This is Annamaya Kosha. Same. We will go for some practices like mud. All not, are not written here, but as main important practices we have to see is butterfly as it happen it as it will leads to pelvic opening, upavishkonasana again. Okay, again it will be strengthening your lower body parts. Baddhakonasana, Dhanurasana, Ustrasana, all you can go for, and especially Marjory Asana, cat pose we can call. It is not written here, but I'll telling cat pose. Surya Namaskar not at the time of menstrual cycle, but before it. Okay, so that it will strengthen it and will leads to mm, will not leads to the problem. Okay, and Marjory Asana very important. Marjory in Marjory Asana, or we also used to call it tiger breathing also, and then holding for the legs up and relaxation. Mudras also Vipreet Karni Mudra, not at the time of the cycle, but before it. Okay. Then Pashni Mudra, then Yog Mudra, Ashwini Mudra, also the contraction, Moolband you can go for, and contraction of 1 second, and contraction of your this lower region or rectum or pelvic region. Okay, contraction of it you can lead for. Now, Pranmaya Kosha, as I told you before, also Pranmaya Kosha will go for Nadi Shodhan, as Nadi Shodhan will open your all the vessels, nerves, and further can leads you to release the problem and also the pain. Okay, Vibhagya Pranayam, all the sectional breathing in Hindi it is called as Vibhagya Pranayam. Nadi Shuddhi, Anulom, Surya Anulom Vilom, as to like more heat will be there, it will release it easily, all the flushes will release easily. Okay, 1 second. So next is your Chandranam Shetali Shetakari Brahmari before. Manumay Kosha, all the meditation techniques at the time of the cycle. The girl will not go for asanas, can go for asanas, but very light, very simple asanas, which can release the back pain and all. Like little dhanura, this your bhujangasana only up till your this one elbows and all. And meditation they can go for more like home meditation, MSRT, cycling meditation, all they can go for, which will leads to the relaxation in their mind and further leads to releasing the problem. Vigyan mein kosa their yogic counseling will go for, then book chapters reading also will go for, give their problem, what is exactly their problem, will make them understand and how it will be released by the practice of yogic management. Anandmay Kosha, happy assembly, karma yoga, all we used to give them. Normally we are doing. This we have completed with our this one menopause. Sorry, yes. So today only this we have completed with dysmenorrhea. We'll go for when last disease in gynecological disorder. So shall we complete this? This is very small. We'll complete today only. Within 5-10 minutes are required. Should we?
Yes, ma'am.
Yes, okay. So with this we'll complete this, okay?
Ma'am, go a little slow because you're like going too fast, ma'am. We
Okay.
can't make any notes if you're going in that pace.
Okay. So note you can make today from this only because I don't want you all to get too much late. Therefore, if in understanding it is problem, you can tell. Your understanding by like theory part you can understanding. No answer.
What, ma'am, was your question about understanding? Understanding, yes.
Yes, understanding is okay, na. So,
Yes.
ma'am, after this year, I just I can give the time, no problem. But I don't want that you people say na that after 9 it is too much. So I just want to complete it also and don't let you late. Okay. So no problem. I will go a little slow. So
We
menopause.
have 10, 15 minutes, ma'am. You can take like 4 or 5 minutes after the
Yes,
class also.
within the 10
Yeah.
minutes I complete. So menopause, with the name itself we understand something which is related to pause, something which is getting stopped, okay, and meno is some related with menstrual cycle, okay. So when menopause is a stage in a life when you stop having your menstrual cycle or periods, okay, it's normal day, it's a normal part of aging. Yes, normally it happens to all the females. Usually the age group is 40 to 40, 50, okay, but main most peak age which is said most common age is 45, okay. Normal part of the aging marks the end of your reproductive years, okay. Reproductive years ends as menopause nears, the ovaries make less of the hormones called estrogen, okay, and after menopause no egg release will be there. For women undergoing the natural menopause, the process is gradual, like slowly it happens because like if the female is getting menopause now before like 3-4 years, or it differs from female to female, okay, or 2 years before the female will start having that symptoms, that 1 month having periods, second month no menstrual cycle, 2 months no menstrual cycle, then third month they are having menstrual cycle, and fourth month they are having too heavy menstrual cycle. Normally having 5 days, then it can have 6 to 7 days, okay, like that, and then next month very less, 2 days only, like that. The different symptoms are there also. Like for females it can lead to normal pain, and anytime in the month 2 times it could happen for 2 days, like that, okay. Many symptoms are there which are like usually females used to feel the actual problem at the time of menopause, okay. So there are certain 3 stages for that, that is perimenopausal, menopause, and then postmenopausal stages, okay. Perimenopause by name itself we understand where before the menopause. Menopause is actual stage where the stops or stoppage of the period. Post menopause after the uh, this menopause stage, okay. What are the symptoms for premenopausal symptoms, and we used to say menopausal symptom. Are irregular periods, as I told you, that irregularly they will have these cycles. Vaginal dryness in there. Usually it is a little uh, greasy, but now at a time it could be dryness. Then hot flashes, chills. Who will tell what is a chills?
It is
It is,
because of the spike in the temperature, body temperature.
yes, it means we feel a little feverish type of things, to maintain the temperature of the body, homeostasis. Okay, night sweat, sleep problems, mood swings. Mood swings usually in the menstrual cycle also they used to have the at the time of that also, because normally what happens, mood swings usually happens for starting stages of the girls. Okay, young girls usually have mood swing, but as it gets they become like 30, 35, normal they are having every time they are having menstrual cycle, so it become normal for them to have the menstruation. But again, when it leads to 40 to 45 age or 50 age, when they are leading to menopause, again this shows lots of mood swings also. Okay, weight gain and slow metabolism for them. Okay, decreasing fertility, of course. At that time, after that, the female will not able to conceive. Loss of the bones because calcium deficiency happens. Bones pain, knee pain, everywhere you can see. Very problem for females. Okay, changing cholesterol level, perimenopausal symptoms. Okay, now your perimenopause and perimenopause or pre, you can say premenopause. In your our syllabus it is written perimenopause. And postmenopause, we'll see, it can begins 8 to 10 years before the menopause, as I told you. Before the menopause, that is perimenopause. Hmm. So it could happen differs again as told, as female to female. It could happen before 4 years it starts showing, before 5 years starts showing. It could also happen that one time it happens that very less periods, or next month normal periods. But again then normal cycle is happening for again 5 to 6 years. Again after that there some symptoms we don't know, and our symptoms can differ for everyone. When when the ovaries gradually produces less estrogen. Okay, slowly estrogen, not exactly it will happen like today menopause happens, not like that. Okay, it lasts uh, up until menopause, the point when the ovaries stop releasing the eggs. Actually the complete release, like in starting it happens that slowly less eggs are released. After that, at the time of the menopause, complete egg releases happen. So in premenopausal it will happen. It lasts for around 4 years, as I told you. Continues till the ovaries stop releasing eggs. Okay, because the stage when ovaries will stop releasing eggs, it will be menopause. So up till that, this premenopausal symptoms will continues. Then, what are the symptoms? Your hot flushes. Then hmm, and then you'll have fatigue, breast tenderness, also in the pain in the chest region. Okay, sometimes these symptoms could also be seen. Irregular periods, urinate, you are incontinency in the urine. Okay, you are not able to, like, sometimes it also could happen in urine. I'm like just remembering this also. Incontinency, okay, the urine leakage also happens to female. Okay, at that time, okay, they are not able to control their urine. Okay, sometimes it could also happen at that time. Mood swings, trouble sleeping, etc. So postmenopausal, this is the name given to the period of the time after a woman has not bleed for entire years. How will analyze? As I told you that it could happen that 3 months female is not having any periods, but fourth month having. It could happen for 6 months, 7 months female is not having periods. Can we analyze that? Yes, she is now uh, in here menopause stage? No. If complete 1 year for 1 12 month complete female is not regularly having periods, then we can analyze that yes, this is the stage she leads to menopause. Okay, now is menopause. So this is menopause. Post menopause. Okay, now complete menopause complete, after that we can next. Now yoga treatment, Shatkan, Jalniti, all that can need all other Shatkams, Kapalbhati and all also we can give them uh, before. And Nadi Shodhan Pranayam, Nadi Shodhan Pranayam, the Pranayams, Brahmri and all also not written because it's obvious. Tadasan, Virbhadrasan, all the asanas which are releasing their pain, Pavanmuktasana and all. Also relaxation technique, Ajapa, Yog Nidra or Om meditation, cyclic meditation, every meditation others also we can give them. Then one term comes that is antenatal care. This is okay. Natal word we used to understand with the something pregnancy. Okay. So antenatal care. What is antenatal care? Antenatal care is nothing but the care you get from the health professional during the pregnancy. Whatever the pregnant at the time of the pregnancy, we're getting health like advices from the healthcare professionals. These are the antenatal care which leads to the care of the baby, the female. Okay, because as I told you in yogic, as we give them yogic counseling, I like that healthcare professionals give them pregnancy counseling. Okay, we can understand like that. Okay, so it is similar to something. It's sometimes called as pregnancy care also, as I told you. They say pregnancy care or maternity care at the time of the pregnancy care, the health professionals giving to females. Okay, you will be offered appointment with doctors who specializes in pregnancy and the birth of the child. This care typically begins early in the pregnancy and continues until the baby is born. As this is pregnancy care, name itself can tell, complete pregnancy will leads to this. Okay, so this is natal care ANC and provided during the pregnancy by skilled healthcare professionals to ensure best health conditions for both mother as well as baby. Very much clear, as I told you. Now, intrapartum care, partum word like here it is not given, is something after pregnancy like that. Okay. So, care provided during childbirth by skilled healthcare professionals to ensure best health conditions for both mother as well as baby. These are the same. Postnatal care, then care provided 6 weeks, matlab like after for the after. Okay, for 1 to 2 months. Okay, can provided 6 weeks following childbirth by skilled healthcare professionals to ensure the best health condition for both mother and baby after the birth of the baby or after the pregnancy, post pregnancy, we can say. Okay, so with this, prenatal care also completed and menopause also completed. Yes, with this, we have completed with this part of our syllabus, gynecological disorders, in which we have these topics. We have completed all of them. Okay. If any doubts, you can all can ask. Just one minute. And you can make notes after this. I will just send you after the class. Any doubts? You can ask. The topic is very easy today. That's why I think to complete it completely. Otherwise, one topic I take for one day.
Yeah, that's clear, ma'am.
Others, please answer.
Yes, ma'am, it's clear.
Clear, na? Okay. So, if no doubts, we'll end today's session. The time, like no extra time, is I have taken only 3 minutes and also completed the whole part. Okay, no doubt. We can end the session. Anita ma'am, are you there? Anita ma'am, are you there?
Yes, ma'am.
Understand?
Yes, ma'am.
No doubts.
No, ma'am. I will revise, ma'am. Menopause
Yes.
and
So yesterday class, last day's class, you have revised.
yes, ma'am. I'm
So
uh,
how many
I'm
types
going
of
going
obesity?
through.
How many types of obesities are there?
Uh, mm, Not sure, ma'am.
Not sure.
Two
Last day,
types, ma'am. Two
what are the
types,
names?
like apple shape and pear shape, ma'am.
Okay, what are their names? Exact names.
Uh, And that's all not sure, ma'am. I will check, ma'am.
As sir will tell, what are the two types of obesities and their name?
Hello.
Yes, sir.
I just remember there are two types of obesities. One is um, apple-like shaped, and one is grape-like shaped. I don't
No, no,
remember
the
the exact
gentleman
name.
also told that only. What is the name, exact name for those? I make you understand with the name that this word is related to females. You can learn like that.
No, ma'am, I didn't remember.
Okay, so now learn. Okay, please revise the before class. 2 days holidays we have. Okay, Saturday it is very difficult for me. Okay, someone is there. You can close the recording. Okay. Now revise the last classes. I can ask question from any class starting from allergic rhinitis to all the endocrinal disorders, all respiratory disorders, cardiac disorders. Okay. Revise all the classes. Today's also, yesterday's also. I'll ask the question in next class. Maybe I will not make you study any new topic, but I will ask last two classes questions. Okay. Obesity and today's class. Okay. Please speak.
Okay, ma'am.
Yes, sir.
Okay, ma'am.
I can take the new topic also. I can ask the question from last two topics also. Or that I can even leave the new topic, okay? We'll do day
Okay,
after
ma'am.
tomorrow. But I'll ask the questions from last classes. Okay, then thank you so much to everyone for today's class. Hari Om.
Thank you, ma'am.
Namaste.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.